Okay, so in the last video we were talking about a little bit of the physiology of normal glucose production and what was starting to happen when you start having diabetes. And we were talking about the glucose and everything. So this was the representation. But now we're going to do it in a different way. And this time we're going to do it this way. So remember that the insulin is kind of a security guard to open the gates. Right now what we have here is the vessels, and these are cells. And our cells are exactly like in our little thing that we were calling stuff. But now we have our system. So as we were talking before, we have our glucose now that is increasing in our body. But that glucose is not going to our cells. Glucose is a big, so if you put like in a membrane and you put like very sugary water versus non-sugary water, the water will kind of go through it. It has a lot of osmolarity that we call, so it has a lot of pull to try to bring some fluids. And we'll see why it's important to understand later on. So one of the signs and symptoms of people with diabetes, the first one, is that they drink a lot and they pee a lot. So they drink a lot because of that. They get dehydrated. So the water that goes from one side to the other is attracted because of the sugar is so high. They're trying to do. So that's why they're trying to drink a lot of water to try to dilute that blood, because that's what the body does. So it makes you thirst. Well, because you pee a lot and you drink a lot, you will pee a lot as well. And not only that is that this, when it goes now to the kidneys will pull a lot of water, and then you'll pee, and you'll see some glucose as well transferring to the urine. And that's why we were talking in the first video, diabetes mellitus, which was like this honey taste. And that's what it means, is that the sugary of this, now you're starting to pee it because the body is trying to get rid of all that sugar because there's no place to put it. And then it ends up in your urine. And that's why it tastes sweet, but that's why also you pee a lot. Not only because you drink a lot, but because that water follows those sugars and it ends up in your urine. And so now this is the diabetes. So like we were talking about, there's type 1, type 2, but we'll continue to talk about. So we were talking about NDM and IDM. So in both diabetes, this is what happens. But in non-insulin diabetic, whatever the cause of it, and usually this is the one that we can do a lot of prevention, and we'll talk a little bit more towards the end of the video of the problem. So to start talking about diabetes, the World Health Organization, their definition is that diabetes is a chronic disease that occurs either when the pancreas do not produce enough insulin, or when the body cannot effectively use the insulin it produces, or what we call sometimes insulin resistance. And so this is two different diseases which will bring two different treatment and two different type of problem. And in self-reliance, it will become important to understand both of them. So we'll start with the easiest one in a certain way, or the one that we can really do stuff. And actually the WHO has some cool statistics here. So the non-insulin diabetic category is 90% of the people around the world. 90% of the people has more that kind of disease. And let's see some more statistics that are pretty interesting. So they have like if you want to check, it's on the World Health Organization, and they have some interesting documents for the people like that. 1 in 20 deaths. The 1 in 20 deaths is attributable to diabetes. 8,700 deaths every day. 6 deaths every minute, just on diabetes. And this is around the world, obviously. And one other statistic that I found that was very so the United States is the third in the world. So the United States is the third ranking behind India and China. So the United States has the third one with the most diabetes. And we'll talk a little bit more about this one later, but they were saying also that I think it's something like 80% of the population that dies of diabetes or complication in the developing country is because they do not have insulin. And we'll talk about it a little bit more when we get towards the end of some of the things that people talk. So okay, so non-insulin diabetic. So I wanted to bring a little bit of statistics, but non-insulin diabetic. So that means that they do produce a little bit of insulin. So that means that their sugars will sometimes goes into. So once, they have a lazy security guard. So once in a while they'll go in, sometimes they won't, but sometimes, some sugar will do. So there's still some production of electricity or the energy into the cells. But still the sugar accumulates because it doesn't go in. So those are the people that we'll see either they take pills, either they treat with diets, and some of them sometimes will also take insulin just to bump it up a little bit, but they still produce some. And will be very important towards the end again because of that difference in the population. For now, let's talk about the insulin diabetic. And this I want to talk about it right now, and this is the big issue. A lot of things that you read on YouTube, and this is the one I want to talk about, is that they say like, if you give some medication to the insulin diabetic patient, maybe they'll be able to survive a longer period of time, or let's make up some insulin, which I'll put a link on the history of that, which we'll talk a little bit more again towards the end. And insulin. This is the World Health Organization talking about it, and when we're talking again, World Health Organization is for developing country and developed countries. So that developing country means usually they're poor. If there would be a solution just by and it's 90% of the people. So basically, the main problem is this one. So only 10% is this. But if they could solve the problem by diet all over that, then they would kind of invest in that. And that's why they're investing a lot in prevention, because we'll see that prevention pays a little bit more time on this, which is diet. But the World Health Organization, big brains, taking a lot, and if they would have a cheap solution, they would apply it, because the cheap meaning money-wise, is that it would be easier to apply in developing country. Well, and this is where the self-reliance comes kind of important. If they would have a solution like this to apply to the people of developing country, they would apply it, because it would save a lot of debt. I mean, we were talking about big numbers here, like, what was it, like 7,000 deaths, 6 deaths every minute. So if they could save some of them, and 1/10 of those, so let's say about 1 every 6 deaths, maybe a little bit, that would be a death that could be saved because of insulin. So, I mean, it's not small numbers. In order to prevent or delay complication, people with diabetes may have to modify their lifestyle. People with type 2 diabetes, what we call non-insulin diabetic over here, often requires oral drugs or sometimes insulin to control the blood glucose. People with type 1 diabetes requires insulin to survive. Let me repeat that. People with type 1 diabetes require insulin to survive. There was a big statistic over here that something like 80% of the people that dies are in developing countries because they do not have insulin. So in a self-reliance situation, insulin becomes primordial. All the other stuff of diets, pills, in the insulin diabetic do not work because of this. They have on strikes of insulin. I need to produce insulin. So some of the pills that we'll give for the non-insulin diabetic, what they'll do is they'll decrease the resistance. So what they'll do is they'll increase either the production of some of the glucose, because we need to do that when we're talking about the liver. Sometimes we need some insulin-ish kind of stuff to kick in, and the pills go and act like this and create some glucose instead of the bad stuff that gets to me, which was the ketones. So the pills helps, and as well as it helps the regulation of insulin at the site of the cell, so that the insulin, the little bit of insulin that I have, I'm not resistant to it. And then the glucose can go into the cells. So that's why I need the pills. But if I do not have insulin, and insulin dependent means they do not produce insulin, that means that only insulin can save their life. And we'll talk again a little bit more towards the end, but insulin can only save their life. So the insulin diabetic people will need insulin. The good thing with the self-reliance is that insulin can be kept outside the fridge for about a month. So that means if you have a supply in the fridge, plus whatever you have on you, that means about 2 or 3 months. The problem with insulin as well is because it's a protein, and the way they kind of do it is that it's very sensitive to change temperature. So if I put it too cold or too warm, it's going to break that molecule, and basically it will become ineffective. So your insulin, you have to keep it to a place that is constant. And so I saw some people recommending to put it in the ground and things like that. And I don't know, if you're going to do this, then check it out. Make sure that you monitor on a constant basis, because of the temperature, the fluctuation of the day and the night and everything, and the season, to see if in the ground the temperature remains at this exactly what you need for your insulin. Because in the fridge, your temperature stays constant. You know, like your fridge goes more or less, but it stays on it wherever you put it. And your insulin has to stay at that. Outside the fridge, it can last for about a month. And that was even from a book I read in tropical medicine, so that means like it's very hot there, and it would still say that insulin can last for about a month. So have like your supplies plus whatever if you're insulin diabetic. The other time too that I wanted to talk quickly, and then we'll start talking about the treatment, is that if I give some glucose to somebody, so if I don't know if it's hypoglycemia or hyperglycemia, because some people with 2-type diabetes can go the other way, so that means either they go low on the sugar or they go high on the sugar. Giving too much sugar won't get them worse. So, but it can get the other one better. So hypoglycemia will improve with sugar, but it won't worsen their condition that bad.